Breast cancer is the most common cancer affecting women worldwide. But here's the important part. When detected early, it is highly treatable. Today we are going to discuss who should get screened, what mammography actually does, when biopsy is needed, and what you should expect during the process. Common symptoms of breast cancer are if you see lump in your breast or armpit, skin dimpling, nipple retraction, nipple discharge, and change in breast shape. However, early breast cancer has no symptoms at all. That is why it is very important to go for screening. Screening means prevention. We detect the cancer even before it is forming. Who should get the screening done? If you are over 40 years, if you have a family history of breast cancer or ovarian cancer, it is very important to encourage the screening. For screening, it is important that you should do your self-examination every month. Secondly, if you are over 40, it is very important to do mammography every year. Mammography can detect cancer even when there is no mass. It can detect few small microcalcification which in future can lead to formation of breast cancer. In younger women, if there is lump, it is always preferred to get an ultrasound done. So what exactly is mammography? It uses low-dose X-ray to screen your breast. It detects microcalcification, detects cancer even before it forms into one, and it just takes 10 to 15 minutes of your time. Mammography is never done alone. Once done, we also screen breast using sonography. Once sonography is done, in that case, suppose there is a lump, we classify them into BI-RADS. BI-RADS 1 and 2 means benign. Benign means there is no suspicion of cancer. With sonography and mammography, we can tell you that you can forget about it, it is benign. BI-RADS 3 means probably benign or suspicious of malignancy is BI-RADS 4. When there is just the suspicion, suppose in case of BI-RADS 4, we go ahead with FNSC to see if there are any malignant changes in the lesion. But when it is BI-RADS 5 and 6, we are very certain of the diagnosis and we prefer going for biopsy straight ahead. What exactly is FNSC or biopsy? In both these procedures, we use needles. First, in case of FNSC, it is a minimally invasive procedure. In FNSC, we take thinnest needle possible. We take the cells from the lesion and then we test it under the microscope to know whether there are any positive malignant cells or not. In biopsy, we take a tissue sample using sonography and a needle. Through needle, we pass gun and then we take few samples so that we can test it under the microscope and to know and confirm the diagnosis of FNSC. How is it done? It is done under local anesthesia. It will just take your 10 or 20 minutes and after that you can go back home walking. This procedure is mostly painless and you will be very comfortable even after a biopsy. So in the biopsy will confirm whether you have cancer or not. Once it confirms that there is cancer, we go ahead with IHC, that is immunohistochemistry report. Your biopsy and IHC report will contain the type of cancer and hormone receptor report, that is immunohistochemistry. Will guide the treatment aspect, whether you need surgery, chemotherapy, targeted therapy or just the hormone therapy. Breast cancer is not a death sentence. With advent of medical field, it is highly treatable when detected early. With core biopsy and IHC, we know exactly the tumor nature that helps in guiding the future treatment. My message for today is if you are over 40, please go for screening, and at any age of life, if you see any lump, please get it screened. Get a USG done if you are young or mammography, and it is very important to do a tissue diagnosis if required. Don't fear it. Let's know what exactly that lesion is made of. It might be possible that it is benign, and even if it is cancerous, there is always hope. So stay determined, stay updated.